The team at NCH Healthcare System spent 3 months hard at work revising its STEMI protocols to treat patients better. STEMI stands for ST Elevation Myocardial Infarction. It's a type of serious heart attack. And in today's Your Healthy Family, I'm showing you what a STEMI is, how NCH improved its protocols, and why the healthcare system says minutes matter.
A STEMI is what we commonly know as a heart attack.
And Dr. Robert Cabedu, president of the NCH Heart Institute, says a heart attack happens when one of the arteries to the heart is blocked.
From 1 minute to the next, oxygen and blood doesn't travel to the heart. Heart muscle suffers and patients can have a sudden cardiac arrest.
There are people that have the big one and that sends them into an instant cardiac arrhythmia and they can die on the spot.
But Dr. John Zellahay says a lot of the patients they see in the NCH emergency department come in with just one blocked coronary artery.
The heart has more than one coronary artery, so luckily it still keeps running, but if you don't open that up, you're going to end up with long-term disability. Their heart's not going to function at 100%.
And minutes matter. The shorter time it takes to reopen that artery, the better the outcome. Dr. Cabedu says when it comes to a STEMI, cardiology divisions follow a key metric at the national level called the door-to-balloon time. The balloon is the device that opens a clogged artery.
The time it takes from the patient, when the patient hits the emergency room, to the time it takes us to open up the artery, that time should be less than 90 minutes according to the national guidelines.
But years ago, compared to other hospitals, he says NCH was underperforming.
We were less than 10 percentile in performance in the time that it took to open up the artery.
So the NCH Heart Institute decided it was time to make a change, working with first responders, emergency department nurses, techs, and doctors for 3 months.
We've been able to lessen that time to approximately 28 minutes, putting us at the 99th percentile in performance for the abrupt treatment of a heart attack.
And Dr. Cabedu says the driving force behind them was their commitment to your health care.
We owe it to our patients, we owe it to our community to provide the best of care.
So from 74 to 28 minutes. So over the next few days, I'm going to walk you through how they did just that and introduce you to the people who are making it happen. That's coming up this week in Your Healthy Family. I'm Lisa Greenberg, and for more health stories, head to fox4now.com/yourhealthyfamily.